My name is David Thornton. I'm a wellness consultant and a doctor of chiropractic. I operate a wellness clinic in Arlington, Texas. My office provides a variety of healthcare services to Arlington and the DFW communities. I specialize in preventative health care and risk management strategies, as well as addressing specific health problems associated with aging, deconditioning, illness, injury, and the stresses of daily living. I also provide chiropractic care to those who need it. In this video, I'm going to show you why my office is going to revolutionize the way you approach your personal health and why it might be the only healthcare office that you'll ever need, saving you time, money, and needless pain and suffering while making it simple for you to strive for optimum health. And yes, optimum health is quite possible without over-the-counter drugs, prescription drugs, or surgery. We can take a look at a spinal model so we can get an idea of what normal versus abnormal is supposed to look like. Here, the spinal model on the left is normal. You have the normal disc, very hydrated and plump, and separating the bones nicely, which allows a nice opening for the nerve root to exit there in the back, that little yellow nerve coming out. And contrast this to the image on the right, we have almost a complete obliteration of the disc on top and in between the bones, as well as obvious erosion and bone spurs and arthritic changes. Also, you can see that the opening for the nerve root is very small and that the nerve is represented as already being damaged from this prolonged arthritic changes or degenerative changes. Look at how this looks on an x-ray. Here we have an x-ray of the neck or cervical spine as viewed from the side. The normal is on the left. Clearly you can see that there's a curve in the spine and the individual is facing to the viewing left. The disc spaces in between the vertebrae are all even and plump. You can see that there's a clear separation between all the bones. There's no changes in the bone shape. They're pretty uniform or symmetrical, and overall a nice presentation. Now, contrast to the image on the right, you can see that there is a complete loss of the cervical curve. There is a loss in disc space heights in between the vertebrae numbered 4 and 5, and also 6. You can see that there's shape changes of the vertebral bodies. The white areas, you can see that they don't look anything like the image on the left, where they're actually beginning to fuse together. And the image on the right goes ahead and makes the point that the disc above 4 and between 4 and 5 are actually the same age. So it has nothing to do with age. It has to do with your alignment and the biomechanical stresses being delivered on these spinal units. Here we have contrasting MRIs of the neck. The image on the left is a normal cervical spine, normal neck, and this is contrasted by the image on the right, which is an advanced stage of degeneration. The image on the left clearly shows a normal cervical curve. It shows the individual vertebral bodies represented by the little square shapes as being normal and separated evenly by the disc spaces in between. And contrast to the image on the right, represented by the circle area, you can see the advanced stage of degeneration, so much so that the disc material is actually protruding back into the spinal cord and compressing the spinal cord. Take a look at the disc as it's removed out of the body. This is a cadaver study of the disc. This is in a lumbar spine, but it can be extrapolated for the cervical spine or thoracic spine, mid-back, low back, or neck. The image on the left is normal. You can see how plump it is. The white area is the disc. The red area on the top and bottom is the end plate where it binds and adheres onto the bone. You can see that the image on the right is severely degenerative and it's almost grizzly or fibrous. It doesn't obviously will not have the same type of flexibility or properties on the image on the left. Okay, to summarize, if you take a look at the normal x-rays on the left, or normal images on the left, and the abnormal images on the right, you can see that if you have a normal cervical curve and normal alignment, that you're going to displace the force of gravity and other mechanical forces through the bone segments and through the joints correctly, and therefore minimize or retard any degenerative changes, and the disc is going to stay healthy, the bone's going to stay healthy, and you're going to have a nice relaxed spinal cord and no compression. Contrast this to the images on the right. If you have a loss of cervical curve, whether it's through trauma or poor posture, poor work habits, poor ergonomics, you're basically going to increase the rate or accelerate the rate of degeneration. You're going to lose disc height. Your disc is going to wear out or degenerate. You're going to have bony changes, arthritic changes of bone spurs. You're going to have spinal cord compression or nerve or root compression. You're going to have signs and symptoms such as pain in the neck or low back with numbness, tingling in the arms or legs, hands, or feet. And I want to point out that this process happens prior to you actually getting any symptoms. It's kind of like a dental analogy. When someone quits brushing their teeth on the first day, they don't get a cavity. It's a slow process. It takes weeks and months, if not into the year, before you get to the point where you have a symptom. So you can see that signs and symptoms are not a reliable indicator as far as the quality of health. And things are adversely occurring before you ever have a symptom. The spine is not like the teeth where you can look into the mirror and you can actually see that there's a problem. You have to realize that if you're not having regular spinal checks and you've had accidents or traumas, or you have a sedentary type job, or you have poor sleeping postures or other ergonomics, that you're more than likely going to be having spinal degeneration. And the fact that you don't have any symptoms does not mean that this does not have to be addressed.